Welcome to Trauma Mommas, the podcast where laughter meets healing. I'm your host, Amber, and here we dive into the raw, real stories of incredible women who've faced trauma, found their strength, and now are ready to share their journey with humor, heart, and hope. Every episode is a celebration of resilience because, yes, you can heal, you can laugh, and you can rise. So grab your coffee or something stronger if you prefer, get comfy, and let's talk about it. Hello and welcome back to another episode of Trauma Mommas. I'm your host, Amber. In today's episode, we're going to be going over my POTS diagnosis and my health journey to get to that diagnosis. On my last episode, which was our first episode, I briefly discussed with my daughter about why she had to call 911 on me. And today I'm going to discuss the full details of my diagnosis and kind of the journey that led up to that diagnosis and my symptoms. So hopefully by talking about my journey, I can help somebody who's going through the same thing or a similar thing, just, to try to help get it out there, because I was misdiagnosed for a long time before I finally got a diagnosis. So my journey started when I was working as a night shift supervisor for 911 Center. And that was in 2022. I suddenly fell off, but couldn't quite put into words what I was feeling, how I was feeling. Not in a way that anybody would understand or that it would make sense, because it didn't make sense to me why I was feeling this way. It was, clammy, cold sweats, was very just out of breath, and I started getting ringing in my ears. I got tunnel vision, and then I was out. The last thing I remember was sitting in my chair at the supervisor desk, and that the other supervisors that were there kind of gathered around me to help. And then they started an ambulance to come to me, which I'm thankful for, absolutely, because that was kind of the start of it all. It was very scary in the beginning when I didn't know what was going on. There was a lot of loss of hope as to how to get a diagnosis and which doctor was actually going to believe me that this was going on. So I woke up from that episode and had a code blue called on me because I had stopped breathing. And while I was having these convulsions and these pass out spells, and they were giving me all these medications for seizures, like Versed, Ativan, Keppra. They were giving me all this medicine that was making me really groggy. And honestly, it was just making it worse because it was making my my blood pressure go down lower, which it's already pretty low. So they admitted me, they ran every test possible. They did blood work, they did a CT scan of my brain, they did multiple 24-hour EEGs, which, if you don't know what that is, it's where they hook you up with all the sensors around your head, which not fun, and it's awful to get the glue out of your hair. They put the sensors around your head. You have to keep it on. You can't take it off no matter how itchy it is. For 24 hours, they put a monitor and a camera directed at me. So my every move is watched. Every time I had a spell where I was in and out of consciousness, and it was all recorded on the EEG. That came back normal. Blood work came back normal. CT scan came back normal. Everything was normal. So they diagnosed me with psychologically induced seizures, meaning stress-induced seizures. And I knew that didn't make sense to me, didn't make sense to my husband as well, because I had already been at the job for a few years as a 911 dispatcher and a trainer. So stress didn't really get to me in a way that I felt like would be crippling like this was. And so, when they diagnosed me with that, they referred me off to a psychologist, which I went, and the psychologist was like, no, this doesn't really seem like pseudo seizures or, stress-induced seizures. This just doesn't really make sense for their diagnosis either. So he ordered a bunch of lab work that was kind of out of the scope of normal, blood panels that they do. So he looks for any autoimmune disorders, stuff like that, that would cause long-term issues. And he did find that I had an autoimmune disorder, but he couldn't pinpoint exactly what type of autoimmune disorder. He just knew that the blood work came back. There was, you know, abnormal lab results for an autoimmune disorder. So he recommended that I follow up with a cardiologist that kept getting recommended to me, and his name was Dr. Snapper. And he's with Bellstar Cardiology. He is one of the best, if not the best, cardiologist for this diagnosis. And I remember calling to schedule an appointment, and they were like, there's a 7-month waiting list. It's really hard to get in, but we'll get you in on the list. And if somebody cancels, we'll call you sooner. So again, 7 months of not being able to control my symptoms, not being able to understand fully what is going on 100%, no medication, nothing, just stuck. So I had to end up leaving my job for quite a few months to try to figure out if it was stress induced. So, but I was constantly having them at home as well. So it that's why it wasn't making sense to me that it was happening everywhere, but I wasn't really stressed. So I took some time off work and I tried to relax as much as possible, just to try to make sure that this wasn't stress induced and that it wasn't my job causing it or what I was doing that was making it worse. So finally, 7 months go by. I get into the cardiologist to see Dr. Snapper, and I am sitting with my husband and we're explaining all the symptoms. And I get like maybe a couple minutes in of like explaining my symptoms, and he's like, wait, I'm going to stop you right there. I know exactly what it is. It's POTS. And my husband and I look at each other, and my husband had mentioned throughout this journey of trying to figure out what it was, misdiagnosis, he had kind of done his research on his own and had mentioned that it could be this diagnosis, but we really weren't for sure. But when the doctor was telling me that, yes, this is what it sounds like, and you also have Ehlers-Danlos, which is just like over elasticity of your joints, your skin, your blood vessels, which makes my blood vessels not constrict in a way. So when I stand up or I move positions, all the blood flow rushes from my head back down to my legs. And so it's not evenly distributed, which makes my heart rate jump 30 beats. And then my blood pressure is always low. So with my low blood pressure and my heart rate jumping up, I lose consciousness, and it comes on pretty quick, but I can usually tell when it's about to happen. But the doctor was like, this is what I think it is. And we'll do a tilt table test to confirm. But he immediately started me on medication, and it was blood pressure medication to try to even out my heart rate and my blood pressure so that they were kind of equal, the same, so that my heart rate wasn't high and my blood pressure was just kind of bottomed out. So with trying to, trial and error with the amount of medication or the dosage and stuff like that, we try to manage it in the meantime before I could get into do the tilt table testing. So I finally get to do the tilt table test, and I'm laying on the table for 15 minutes, flat on my back. And then they say, okay, we're going to lift you up. And I'm strapped down to the table. So they lift me into the upright position, and my heartbeat jumped 40 beats from laying to upright position. So it jumped 40 beats, and I passed out right on the table. Luckily, I was strapped in, so I didn't hit my head or anything, but they were prepared just in case. So with that as like the official diagnosis, then I start to realize, okay, I'm not completely crazy, still a little crazy, but not in the way that the doctors were saying that I was, which was basically this was all in my head and I just needed to go to therapy, which it was not. So I do have POTS, which is postural orthostatic tachycardia syndrome, and I also have Ehlers-Danlos. So those coupled together, my blood vessels are not well. My body does not retain fluid. So basically, the treatment for POTS is blood pressure medication, as well as lots of fluid, lots of water, 120 ounces of water a day I have to drink, on top of lots of sodium. So all the electrolytes in the water, I have to have sodium tablets in the morning, have to have lots of sodium and snacks throughout the day to keep my blood pressure from plummeting and my heart rate jumping up. So I was able to get that done, but for some reason I was still having them so often. So they finally were like, you might need a port for your infusions, because by this point they had also realized that I wasn't retaining the fluids orally. And so they wanted me to go to the hospital once a week to do an infusion, which is like where the chemo center is. I go in and I would have an appointment. I would go in, they would put the needle in and do a liter of saline there at the hospital and the infusion center. I did that for a couple of months until they realized how hard it was to get a vein because of Ehlers-Danlos. And I only had one good vein that was bruised every time I would go in, and it was painful. So the doctor recommended that I get a port put in my chest so that it was easier for me to do the infusions at home at my convenience, so that I would have a home health nurse come once a week and change my dressing and show me how to use the port and hook myself up to the IVs. And it's just saline fluids. There's no medication in the bags of fluids. It's a liter. Now I've gotten to the point where I do them every other day. So I do 4 times a week. And with the chest port, it was uncomfortable. And I have to say that people who have them, who go through chemo or whatever medical condition that they need to have a port, kudos to you. You guys are heroes and brave, and I commend you, because that was probably the worst ever. It was super painful because I would have to insert the needle directly into the port through my skin and leave the needle in for a week at a time, because I was doing the infusion so often. They didn't want me to keep exiting and re-entering the port, so that that would be less risk for infection. So I would have this big bulky needle kind of sticking out that was taped down as best I could, and it would move, especially while I slept. And I'm a stomach sleeper, so having that on, and I couldn't roll over because it hurt and I had the risk of pulling it out. So after a while, it started to hurt really bad, and I noticed there was a lot of redness and swelling, and I was getting really, really sick, like vomiting, like very bad, like feverish. So I went to the hospital. They looked at my port, immediately admitted me, and kept me for 3 days while they did culture samples from my port. And they came back and I was septic from my port. So they wanted to take it out there. I, however, did not, because I knew that that was my only option to a semi normal life. If you take that port away from me, I'm not going to be able to get in my saline infusions. And I already know that my body doesn't retain the fluid orally. So by taking the chest port away, I'm taking away my ability to help myself. So I felt like it was a defeat, and then I was back at square one, and then I thought I was going to have to do this all over again. But they suggested that I do the external catheter. So it's a tunnel catheter, and I can kind of show you, but it's pretty taped down. So instead of it being a port, I have the scar here still from the port. So they kind of moved it over. and it is a tunneled catheter. So the tubing goes in here to my chest, goes through my carotid, and directly into my vessels in my heart. So this one is, instead of having to stick the needle in, I have 2 lumens that hang from this, and I just, obviously I do the procedures where I clean it, I flush it, make sure everything's working properly, and then I just hook up to the fluids. I have my IV pole, and my nurse still comes once a week to change my dressing, make sure there's no infection. And I have to say that this is like a breath of fresh air compared to the port. Port was very uncomfortable compared to this. And this may seem like it would be more uncomfortable because instead of underneath the skin, it's outside, and I have these like really gross looking, lumens hanging down from my chest. So I had to get used to all the questions being asked. What's wrong? What is that? What happened? Are you okay? Even by when I did end up, after getting this put in and figuring out my diagnosis and how to treat it and getting better and on the mend, I did come back to my job as a 911 dispatcher. I just kind of stepped down in the role of just the dispatcher and on a modified schedule and not supervisor, just in case I couldn't handle it, because I wanted to make sure that I could go back and handle it without regressing at all. So I did end up going back, and I have to say that my job is amazing in the fact that they are super supportive of me. They're very accommodating. Um, I'm very lucky. I've been with this company for 6 years now, and they've been amazing when it's come to my diagnosis and treatment, as far as accommodating and understanding, and just they care a lot. So I did end up going back to work. I do my infusions every other day. I hook myself up, and the pole is collapsible, so I just kind of carry it with me wherever we go. It's not debilitating anymore. It is refreshing to have an answer and to finally have been heard by a doctor that understood and didn't think that I was just crazy and kind of making this come on myself. So, now I have rescue protocols that my husband, my close friends, my family, coworkers, even, they know the deal, they know the drill. So if at work I do feel like if I'm about to go down, or I'm about to have, I call it an episode because they're not seizures, they're just convulsions because of me passing out. And when I feel that flush of my ears are ringing, my tunnel vision's coming in, I'm gonna pass out. So I let them know, and I have a little bell or like a little life alert kind of thing. I push the button, it goes to the supervisor's desk, and they hear it and they know, okay, we need to start an ambulance for her just to check her out. And they do. That's their protocol, which I totally understand. They're not needed every time, but they they do help. And I have grown close with the paramedics that come and see me almost every week. And they know exactly what to do. They know not to give me any of the seizure medications anymore. They know to just give me fluids and let me come out of it, because I will come out of it. They last anywhere between a couple minutes to, on my worst day, I would say maybe 20 to 30 minutes they've lasted. And that's not common. So that long of a time for me to be out is not, it's not common. Usually it's something on top of, like, I'm getting a cold or not feeling good or just dehydrated, super dehydrated. It's amplified. And especially during the hot summer months, heat definitely makes me dehydrated a lot faster. So it is more common for me to have these pass out spells more often. But I would say that overall, I have been doing so much better than where I started. And I'm very thankful that my husband, my family, my friends, my coworkers have all been there for me, have all stood by my side and been through the thick of it with me, because there was a lot of times where I thought I was just going to be left alone and broken and nobody was going to want me. And I felt like a failure as a mom, as a wife, I as a as an employee. And then there was a lot of back and forth with my husband and I on the type of treatment, and he's very to the point, like he needs a specific diagnosis and treatment plan. We've been through it with my daughter, with her medical issues, which we will discuss in a later episode, on how I've handled her diagnosis along with my diagnosis. But I will say that my husband has been there, my number one supporter, has stuck by my side. Even my daughter has learned what to do. And unfortunately, in situations where there it is emergent, she has had to call 911 on me or call somebody to come and help. And I'm just grateful that I now have a concrete answer with a treatment plan in place. I'm doing better. I don't have them all day, every day like I used to when I first started having these spells. And I just would love to hear if anybody else has gone through something like this or your journey. I would love to hear, because I know for me, finding out that other people have this diagnosis made me feel not alone. So for me, I wanted to go through my diagnosis for those people who could be in limbo of getting diagnosed properly or still trying to figure out what's going on, or if they do have a POTS diagnosis or other things that they've dealt with that are similar to my situation. So I would love to hear your stories. I would love to know what happened and if you're on the up and mend, and I hope everybody is doing well, and I hope to see you guys again soon. Thank you so much, and I hope you enjoyed this episode. Feel free to reach out if you have any questions, and I will see you on the next time of Trauma Mamas. Thank you so much.